Assalamualaikum students. How are you all? Uh, I hope you are doing fine. Um, as you all know, that my name is Dr. Habib Rehman, and I'm sharing and this lecture with you um, about nutritional anemia. Um, let's go forward. Of course, as I've always said, that we will be discussing the learning objectives of today's lecture, and these are define anemia, classify anemia. The third one is list the causes of nutritional anemia and explain the consequences of nutritional anemia and discuss prevention and control of nutritional anemia. So students, the topic for my today's discussion is nutritional anemia, as you all know, but we will be discussing little bit about anemia and classification of anemia as well. Let's go forward. And of course, you should all remember that learning objectives are very important, and these are forwarded by our governing university. And for examination purposes, to know these objectives is very important. And usually the examination questions are developed from these objectives. So you should always be focusing on these ones. Let's go forward. Starting with anemia. Anemia, as you know, is a condition in which the number of red blood cells or hemoglobin concentration within them is lower than the normal. And WHO World Health Organization estimates that 40% of the children between the half years of age, 6 months to 59 months of age, and 37% of the pregnant women, and 30% of normal women of fertile age between 15 to 49 years of age worldwide are anemic. So it's a widespread, prevalent public health issue. As you can see, on the left is an anemic cell blood, and on the right is the normal picture. Iron deficiency anemia is the most common cause of anemia in females, primarily due to their recurrent menstrual loss of blood, and secondarily due to poor supply of iron in the diet. There is loss on one end and there is no supply on the other end. So this is a serious issue. Now moving forward, we will discuss about this is the second objective, classification of anemia. I have discussed the classification of anemia in three parts. One is according to the etiology, that is the cause, then there is morphology, and then there is pathophysiology. Uh, Etiological classification starts with iron deficiency anemia. Students, usually iron deficiency anemia is considered as the nutritional anemia, and it is also the most common nutritional anemia. But also on the second number, vitamin B12 deficiency anemia, and due to pernicious is also called pernicious anemia. It is also very prevalent. Then there is folate deficiency anemia. Folate is also called B9, vitamin B9. And then there is hemolytic anemia, anemia of chronic disease due to many diseases, aplastic anemia, thalassemia. These are the genetically, due to the um, genetic reasons. These anemias are also prevalent in consensuous marriages, sickle cell anemia, and hemorrhagic anemia. Now, this is the etiological classification. Now, coming forward onto the morphological, that is the shape of the red blood corpuscle. It can be described as microcytic anemia, that is the MCV is less than 80 femtoliter. Then there is normocytic anemia, in which MCV is between 80 and 100 femtoliters. And of course, macrocytic anemia, in which MCV is more than 100 femtoliters. Now, coming on to the pathophysiological classification, there is hypoproliferative anemia due to decreased production of red blood cells. Then there is hemolytic anemia due to increased destruction of red blood cells. And then there is blood loss anemia due to acute or chronic bleeding. Now, moving forward, classification of anemia. We will describe also about the morphological classification. Microcytic anemia characterizes by small sized red blood cells. Common causes is iron deficiency anemia and certain genetic diseases that affects hemoglobin synthesis. Then there is normocytic anemia. Red blood cells are normal in size, but there's still a deficiency in their number or hemoglobin content. Causes can include chronic disease, kidney failure, and acute blood loss. And then there is, of course, macrocytic anemia. This is also very prevalent kind of nutritional anemia. In this, red blood cells are larger than the normal. This type can be seen in vitamin deficiencies, particularly vitamin B12 and vitamin B9, that is folate, and due to certain medications like proton pump inhibitors, usually omeprazole or lansoprazole, that can uh, that can have some issues with the intrinsic factor, and then that can lead to the deficiency of vitamin B12. And of course, tobacco can be one of the reasons that intrinsic factor is decreases from the stomach lining. Now, moving forward, nutritional anemia. Now we have been discussing only about the anemia, but now we are narrowing and directing ourselves towards the topic of today's discussion, that is nutritional anemia. Nutritional anemia results from deficiency in either iron, vitamin B12, or folic acid, although in most areas of the world, nutritional anemia is synonymous with iron deficiency anemia. Nutritional anemia occurs most commonly at times of heightened physiological requirements. That is that the when the person is young or at the uh, senior years of life, when the requirement is the most, and we see that the deficiency is also there. If you can appreciate the picture, that is about the nutritional breakup, and all these products can give you good supply of folate and protein, vitamin C, and iron. Now, causes of nutritional anemia. There are three main types of nutritional anemia, and then I've added few more. And the top three are the more important one. That is iron deficiency anemia, vitamin B12 deficiency anemia, folate deficiency anemia, and vitamin C deficiency anemia, and of course, protein deficiency. Moving forward, iron deficiency anemia, it is the inadequate dietary intake of iron-rich foods, that is red meat, that is meat from cow, bull, poultry, fish, beans, lentils, and spinach. Poor absorption of dietary iron due to factors such as GI disorders that include celiac disease, IBS, and gastric surgery. Increased iron requirement during periods of rapid growth in status, both infancy, adolescence, and pregnancy. In pregnancy, there is the double requirement because the baby is also growing in the fetus. The fetus is also growing in the uterus, and there is a requirement for both. Iron deficiency anemia is also morphologically the most important point to note is that it causes microcytic anemia morphologically, and the finding is MCV is less than 80 femtoliters. Now, coming towards the diagnosis of iron deficiency anemia, of course, you have to take medical history and inquire about the symptoms. We will discuss these generally, and about the physical examination, it is also important. Complete blood count is important to check CBC and hematocrit, and of course that you have to go through the peripheral blood smear to examine red blood cells. And then you can also go for ferritin, serum ferritin levels to measure the iron storage, and of course TIBC, total iron binding capacity, to assess the transferrin levels and transferrin saturation to check the iron saturation in percentages. And of course, there are some further testing to consider. Now, you see the symptoms that may include fatigue, tiredness, poor physical exertion, headache, cold sensitivity, cold hands, lightheadedness, hair loss and thinning, dark circles around the eyes, and weak and dizziness. As you can see, both the pictures in which there is deficiency, that on the left is the normal blood and on the right is the anemic picture. Now, treatment. Treatment, of course, has supplementations, iron supplementation prescribed by the doctors in severe cases. Uh, and in dietary changes, that includes increase in iron intake, that includes the pictures that are on the right, that includes red meat, and even the meat from the goats and sheep. If a person is not able to eat cow due to some religious reasons, and of course leafy greens and green peas, dried fruits, poultry, cooked spinach, egg yolk, Brussels and broccolis and legumes and shellfish. Um, Vitamin C also helps to enhance the iron absorption. This is also important. In severe cases, there is blood transfusion that is required. And of course, you should always focus that if the disease is due to some underlying cause, then you have to address that cause as well. And of course, regular checkups. And now for the next topic, um, that is vitamin B12 deficiency anemia, also known as pernicious anemia. This can be a stem, so you should all focus on this. This is this uh, in vitamin B12 deficiency, there is inadequate intake of foods rich in vitamin B12, including fish, meat, dairy products. Impaired absorption of vitamin B12 due to conditions such as pernicious anemia, in which autoimmune destruction of intrinsic factor is there, or GI surgery, or disease affecting the ileum in Crohn's disease. That is very eminent. And of course, on this note, you should note down that vitamin B12 deficiency, also known as pernicious anemia, and gives you macrocytic anemia, and MCV is more than 100. This can be an important question. How would you treat vitamin B12 deficiency? Of course, underlying cause should be focused, assess the symptoms, measure B12 levels, intrinsic factor antibody test that to check for pernicious anemia. In this, the lining is destroyed, and pernicious anemia, there is no secretion of pernicious anemia. There is no secretion of intrinsic factor from the stomach. The intrinsic factor, what it does is that it captures B12 molecule from the stomach and takes it down to the small intestines, and there it is absorbed. So if there is no secretion of pernicious anemia, there is no secretion of intrinsic factor, then it may be disturbing. Other levels include homocysteine levels and methyl malonic acid test. These are the additional markers, and of course, treatment of B12 supplements or injections. Now, injections are very eminent in this regard, because if the deficiency is due to intrinsic factor, either because of the underlying causes pernicious anemia, that is autoimmune destruction, or is it due to the PPIs, that is proton pump inhibitors. In both the cases, if you will prescribe patient to take oral injection of the tablets, it will be of no use. So you have to prescribe them intramuscular injections, that is vitamin B12 injections. Of course, in those cases, dietary changes will not that much help, but we have to still tell them to have good food that is rich in B12 foods. And follow-up is mandatory in this regard. You see, you can look around the picture. Now moving forward. Now this is a B9 deficiency. That's also called folate deficiency anemia. Inadequate intake of folate rich foods, that is green leafy vegetables, citrus fruits, that includes uh, oranges, even lemons, and some other citrus fruits, and fortified grains. What are fortified grains? Fortified grains are that there is systematic um, inclusion of certain products or nutrients in the normal diet that may include fortification of butter, fortification of milk, fortification of wheat, and that is flour for the consumption. And of course, there is also fortification of some important factors in salt as well. That is usually we know of. And then we will discuss folic acid deficiency now more. What it does is that there is poor absorption of dietary folic acid due to gastrointestinal disorders or due to medication that interfere with folate absorption. Increased folate requirements during the periods of rapid growth, that is pregnancy infancy. Now, important point to remember in this regard is that in folic acid deficiency, there is again macrocytic anemia present morphologically, and MCV is more than 100 femtometers. So you have to make differential diagnosis between vitamins B12 and vitamin B9. How will you diagnose it and treat it? Of course, you will go for the folate levels, evaluate the intake, and prescribe as needed. Increase the intake of folate-rich foods and address underlying causes that include identify and treat the issues and monitoring the response for follow-ups. If you can see the symptoms and signs that are present on the right side, that is swelling of the tongue and loss of appetite, gray hairing, that is the hair turn gray, migraines, and mouth sores. Now, regarding vitamin C deficiency classically does not causes anemia, but it is very important factor. Inadequate intake of foods like vitamin C, that is citrus and strawberries and bell peppers, can cause this. Vitamin C enhances iron absorption, so deficiency can contribute to iron deficiency anemia indirectly by impairing iron absorption. Vitamin C deficiency usually does not cause specific morphological type of anemia, but it can cause any kind of issues, particularly exacerbate the iron deficiency anemia, leading to microcytic anemia. Now, protein deficiency anemia. Inadequate intake of protein-rich foods, example, meat, poultry, fish, and eggs, dairy products, legumes, nuts, can cause this. Protein is essential, as you all know, for synthesis of hemoglobin and other components of red blood cells. Inadequate protein intake can lead to impaired production of red blood cells, contributing to anemia. Protein energy malnutrition, such as kwashiorkor and marasmus, are examples. Generally, protein deficiency itself does not cause a specific morphological type of anemia, but it can contribute to various forms of anemia due to overall nutritional deficiency. Now, the symptoms of this can be these are the symptoms of protein deficiency, not the protein deficiency anemia. And anemia is also listed in this. Now, about the consequences of nutritional anemia, that is usually the symptoms and even signs that includes fatigue and weakness due to reduced oxygen delivery to the tissues and organs and pale skin, resulting from decreased hemoglobin level, shortness of breath, dizziness or lightheadedness, cognitive impairment, uh, and complications during pregnancy. This is very important. As you know, Pakistan has a very high maternal mortality rate and maternal mortality ratio, and this is very important. And it can also cause increase in, and it can increase the risk of preterm birth, low birth weight, and maternal complications. Now, what you can do is that for the prevention and control of this, you can ask the community to consume varied diet rich in iron, vitamin B12, and folate, and supplement when there is the patient is not willing or is not able to purchase these products. As we live in a developing country, we should also prescribe them some medical uh, interventions and to help them avoid hindrances and treat gut conditions to optimize absorptions. That is treating the underlying cause. And of course, regular screening and early treatment. This is very important as we are discussing about the preventive measures. And of course, how can we forget the public health intervention that include implement community education, fortify staple foods, and improve healthcare access. So, my dears, um, that's all for the day. I hope that you enjoy my lecture. Take care. Allah Hafiz.